When we're talking with a client and they're saying, hey, I'm feeling anxious at work, and I'm like, oh, I wonder why that's normal. I wonder why that's there.
I can't tell you how many times, and you've probably experienced this as well, where I have clients tell me, regarding a particular trauma, they're like, it's so stupid. I know that I'm not in that situation anymore. I know I'm never going to be in that situation anymore. Why can't I get over it?
Sometimes with these messages, these lessons that are learned, they happen when we're young. And when we're young, our prefrontal cortex of our brain that we're using now to think with was not really activated. I might know I'm a valuable person, but I don't feel it here.
Welcome everyone back to another episode of The Lighter Side of Heavy Things, where two therapists, myself, Chris Clark, along with Dwayne Horton here, discuss and talk about some of those lighter side of the heavier things that we experience in our roles as therapists and in the world of mental health. And, Dwayne, the past couple of weeks, we've been spending some time discussing and talking about trauma specifically. And we kind of, I guess, came to a conclusion that maybe a good way to kind of cap a little bit of this off is just discussing treatment
Right.
for trauma and what we see and experience with that.
And I think that's an important topic because I think there are a lot of methods that are available for people to use for trauma treatment. And while we know a lot of them, we're not trained in all of them.
Right.
Right. And so we don't want to portray ourselves as experts in all these other fields. We're going to just give generalities of what they are and let people kind of look at those if they want to go into those other ones. But what we are trained in and what we are professionals in and certified in is EMDR therapy. So the eye movement desensitization and reprocessing.
Yes.
And so we'll spend a greater deal of time on that. But what are some of the models that you've seen out there for treating a trauma?
I mean, definitely, I feel that a major one that you often see is, your CBT types of trainings, or therapies, the cognitive-based ones, and there's a reason for that because, as you know, when we go to school, that's like a big portion of the therapy that they talk about,
right?
And they discuss and how it works and all that sort of stuff. And I guess what do you see as some of the benefits that come from utilizing like a CBT type of a therapy?
Well, cognitive behavioral therapy, CBT, kind of focuses on our thoughts, how we think about process situations, and that leads to emotional responses, right?
Right.
Or helps us recognize illogic within our thinking, right? And while that can be helpful, I see it very beneficial. The reason I hated even attempting that as a clinician, because yes, there are trauma-informed therapists.
Yes.
And that's especially within cognitive behavioral therapy. But while they are there, a big part of it is learning to desensitize it through talking about it.
Right.
Bringing up lots of the subject, talking about it, slow exposure to it. Things that are very cognitive in nature. As a therapist and as a dad of kids, I didn't. That was the reason I avoided trauma. I didn't want those stories in my mind.
Yeah.
I didn't want that stuff in my life. I wanted to avoid that. I call me a wuss or whatever you want. I can't. Like, little kids being hurt was just too much for me mentally to hold. And even knowing that they may be adults telling me about their traumas of the past, I recognize that was just way too much emotion for me. I don't want to hear the ugly of that.
Yeah.
I could deal with all the sadness and all that. But that was very hard for me. And it felt hard and difficult for me as a therapist. It just didn't feel right.
Right.
But another one is like acceptance commitment therapy, ACT, right? What do you know about that one? How does you see that one being helpful?
I see that being helpful, kind of as you mentioned that idea of the acceptance, right? Which is a very important part when it comes to working through particular traumas, right? Because for some people, when they've experienced something really terrible, it can be hard for them to kind of believe that that happened to them, right? That's now part of their life story.
Right.
And that denial at times can really eat at a person.
Right.
And so being able to help them work through that, and in knowing that it's okay to accept.
Right.
And just because that happened, it doesn't mean that everything else that comes, that a person might believe comes along with that thing that happened to them, has to actually be that.
Right. Well, it's kind of similar to like an addict, right? One of the
Yes.
first step, one of the 12 steps is acceptance.
Right.
Right.
I am an addict.
I am an addict, right?
Yeah.
Acknowledging that it may have happened. And that's not saying that they're a horrible person. It's also accepting the facts that they're flawed.
Mm-hmm.
Accepting trauma and bad things happening does open up avenues toward healing.
Yeah.
Right.
Yeah, and it's interesting when you think about that, right? How addiction is very it is very traumatic. All
Right.
Not just the addictive behaviors themselves, but usually the things that come along with it. And
Oh yes, all my horrible trauma stories. The worst ones I've heard have been in the throes of addiction.
yeah,
Right.
yeah, and so being able to accept that can be very healing for those individuals.
Right.
Right. And so another therapy that comes to mind when it comes to working through traumas and things of that nature, you kind of touched on a little bit with the CBT, but there's in the past been a lot of exposure therapy.
Right.
When it comes to exposure therapy, my mind just goes to the ideas of like, do you remember watching like Fear Factor?
Oh yeah. Jump in this box of rats.
Yeah. Yeah.
That was traumatizing.
Yeah. And so like before, I guess I should say that before my better understanding of like what goes into it, that in my mind was like, oh, that's exposure therapy.
Right. It's definitely not that traumatic, but yes.
Yeah. Stick your hand in, you don't like spiders, put your hand in this box with the tarantula.
Yes.
Oh
man. Give it a kiss.
Yeah. You don't like snakes, here's a bathtub.
Yeah.
We're going to fill them full of,
Man.
We'll expose it to you so much that it won't be traumatic anymore. Right. And, I will say that I've seen some struggles that sometimes occur when people don't. Well, I guess this is a good segue into something that I think is important, is when people don't maybe understand the entire process of how a therapy works, but maybe they feel like they have a general understanding, and so they try to apply those things themselves, but they make it worse.
Right. I mean, God, could you just imagine it's like having a basic understanding of like a reactor, a nuclear reactor, who can make it portable, and then giving that to a tribe and saying, here's how you plug it in and here's how you get the power out, right?
Right.
And then it's like, they're like, oh, this is great. And so then they start opening it up and playing around with it, not understanding the dynamics of it, and then everybody dies.
Right. Right. And, as bad as it sounds, there are so many times I've worked with clients that as we're talking, especially about things in early childhood, where you can tell that their parents were trying to instill something or help them work through a fear or something like that, and the parents ended up making it worse.
Right. Well, and that comes back to some of the stuff we talked about in the previous episodes, where we're talking about how the brain develops and processes, and what parts of the brain are active at these different phases of those children's lives.
Right. And so, perhaps, maybe they didn't like, their green beans or whatever, and so they were forced to sit there until they had to eat those green beans.
I'll never eat squash.
Right. and we can understand where the parents coming from. We want you to learn to eat foods even if you don't necessarily like them, because it's, number one, it's good for manners. Also, it's probably good to have a well-rounded diet, those sorts of
Right.
things.
For
But
sure.
you ended up traumatizing the kid to the point where they're like,
Spaghetti squash got thrown around the kitchen one day.
yeah, like I am never going to touch that.
No, never. And I told my kids, you'll never have to touch that either.
Right. Well, and for me, like, for example, like steamed cauliflower.
Oh, yeah?
For me, that I had so many times as a kid where it was just like, I had to sit there at that dinner table and told I couldn't leave until I ate,
Oh, yeah.
ate it, and I couldn't do it.
Yeah, we have stories for days on those.
And what's funny about that is that, so that was my thing, but I remember my mom also telling us, because I was like a teenager before I ever had asparagus.
Oh, were you?
Yeah, and I liked it. And I remember asking my mom one time, like, why did we never have asparagus? And she's like, I hated asparagus. My mom, and it was funny because as she's telling me this, I'm thinking, play by play, that's like the same thing you did to me with cauliflower, right? And then she told me, she's like, yeah, that's why we've never had asparagus, and also why we've never had parsnips.
Oh, man, that's hilarious.
But maybe that goes back to what we've talked about, the generational trauma, right? But tying it back in, I guess, to the exposure therapy side of things, right? Exposure therapy is definitely more than just we're exposing you to this thing that you have a terrible thing about, or a terrible thought or feeling about, right? There's a lot of building up, giving that person tools. How do we calm down? How do we regulate? All that sort of stuff. Let's talk about it. What do we notice? What is the thing that, what is it about this thing that's really terrifying?
Yeah, it's like the what about Bob baby steps.
Oh, right. Baby steps around the office. Baby steps out the door.
Exactly. Baby steps into the elevator.
Yeah.
Exactly. It's like same thing, like same principle. People are afraid of flying. You baby step onto a plane, or heights, or blood exposure. Like those things are right. There's all those. I mean, there's other systems that used and designed to treat trauma, such as internal family systems, or IFS. And these are a lot of cognitive-based models, a lot of organizing. How do we organize data in our mind? What's available? What's here? Why is it here? Why are we experiencing this? How is this good for us?
Yeah.
Right? But why EMDR? Why eye movement desensitization and reprocessing? Why is that one important to you?
So I guess the reason I feel like it is very important is because, as you mentioned, a lot of these other therapies are definitely based in the cognitive mindset. And, there's a reason for that. It's easy to measure. It's easy to quantify. It's easy to research,
Mm-hmm.
That's why there is so much regarding that. But the reason I feel that EMDR is different and at times very helpful in processing a lot of that is that for a lot of people with their traumas, they don't need the cognitive aspect as much, right?
Mm-hmm.
What they need to do is be able to process and work through the emotional side of what's gone on. I can't tell you how many times, and you've probably experienced this as well, where I have clients tell me, regarding a particular trauma, they're like, it's so stupid. I know that I'm not in that situation anymore. I know I'm never going to be in that situation anymore. Why can't I get over it?
Right, and they minimize it, and they try to dismiss it. Yes, all the time, like daily when we're working with clients on this. And it doesn't even have to be like significant, like the big T's we've talked about in the past.
Right.
It could be small things. Like, why can't I get over my fear of butternut squash?
Yeah.
Right?
Cauliflower. Pineapple on pizza.
But there's also another factor too. Sometimes with these messages, these lessons that are learned, they happen when we're young.
Mm-hmm.
And when we're young, our prefrontal cortex of our brain that we're using now to think with was not really activated. It wasn't developed in a way that it was processing information the way it is now.
Right.
So it has no connection to that.
Mm-hmm.
When we're young, we're using only our limbic system of our brain, the system that is very primal. It's the fight or flight system.
Yeah.
Or
It's our feeling brain, right?
Right. It's where emotions are stored, where memories are stored. They have all those connections. And then the body also remembers it.
Yes.
Right? Like, like just thinking about spaghetti squash, now that you brought that one up, like I can oh man, I could just feel the grossness. It's a texture thing. Well, not a flavor, but texture too. For me.
That crunch.
Oh no, it was steamed. It was like baked like a yam, and it was I can't do yams for the same reason. Like
See, but with EMDR, what I think is really important in understanding it and why it is so helpful at processing those traumas is that it helps the person reconnect with that emotional side, but in a safe environment, and allowing them that opportunity to freely explore those feelings that are associated to it and kind of work through them.
Well, exactly. And kind of building, it's not necessarily working through it. To me, there's two beauties that I love about EMDR. First, while I can see tremendous value in clients putting words to what happened to them when they're kids, right? And I can now, I'm mature enough, I can listen to that stuff and be okay because I've seen people get through their traumas, right? But putting words to it can still be very tough. With EMDR, they don't have to. They don't have to spill all the details of what happened.
Yep.
They can reprocess that by just noticing the present moment, noticing what's happening somatically, like we talked about last time.
Right.
In their system.
It's kind of like how you're mentioning the spaghetti squash or the squash in general, right? Like you can't put to words maybe those feelings or the descriptions that you're experiencing regarding that, but I don't need to necessarily know that in the EMDR space for you to process that.
And processing, what it means is it's like a train moving down the tracks. If it's stuck in the tracks because something's blocking it, it means the body still thinks it's happening, right? So when they're reprocessing, what it does is it's like unblocking that and allowing those natural emotions that should have occurred then to go through and feel through, that they get through, and then they get done and it's completed. And then the brain's like, I don't have to worry about that. And so I think we can talk more about that, but let's give I think it would be good to kind of talk about broad view, what is included in EMDR. What is EMDR? And how do we go about doing it?
Yeah. So, I mean, as you mentioned, EMDR stands for eye movement desensitization reprocessing therapy, right? And it is a very new therapy in the world of therapies, right?
In the world of therapies, it started in the 80s,
right? It compared to what we talked about, CBT, some of these other things, that's been around for years, well, decades and decades.
The problem with EMDR is we don't know why it works.
Yes.
And so cognitive behavioral therapists and others, when I was in grad school, they talked about EMDR as voodoo. Or the holy christening. And I'm not trying to be offensive to anybody out there. That's literally what it is. Because it has to do with us moving the eyes back and forth, right?
Right. And so with EMDR, right, as you mentioned, the way I've heard explained is to kind of the basic fundamentals of how we understand it is working, right? Is that we are accessing or firing up the limbic system of the brain, that feeling center, right? We ask certain questions, bringing a certain event memory up. Notice what the negative beliefs or feelings are that are associated to them. We bring in the somatic portion, noticing, where do you feel that in your body? Right? And then we start with the reprocessing. We start stimulating the eye movement using a bilateral motion. And what we find is that with that stimulus, it's almost in a way we are manually working that reprocessing center in the brain, to help them begin to work through the emotion. Like you said, we're unblocking the train tracks.
Right. And so what you're talking about is kind of like phases 3 and 4 of them. So EMDR. So what's interesting is Francine Shapiro And then later in life, wish she hadn't named this therapy the eye movement desensitization and reprocessing, EMDR. She had wished that she'd named it the AIP, because the overall model that we look at is the adaptive information processing, right?
Right.
How is the past affecting the present? So any EMDR therapist, when we're talking with a client and they're saying, hey, I'm feeling anxious at work, and I'm like, oh, I wonder why that's normal. I wonder why that's there, right? How has that been adaptive in the past? How has anxiety been good for them, right? That would be kind of what we call phase 1 and 2 of EMDR. So it's history taking, and kind of getting the assessment and all that stuff of what is all there, right? Phases 1 and 2 of preparing our clients to do it. That includes stuff like mindfulness, noticing our somatic experiences, noticing what's happening here in this moment, prepping them for what you were talking about, that dual awareness part, right? Where when we're reprocessing, I describe that dual awareness like this. Like with my clients, I say, hey, I want you to notice what's happening now, and like almost imagine it playing on my wall.
Yeah.
Right?
It's a movie.
It's a movie, right?
And the end, you know the beginning. Let's just see what comes up.
Yeah, let's just notice what happens now. And I tell them that's important. I don't want you in that movie because we call that a flashback.
Yeah.
Right?
And that's why they're disruptive.
And we don't want that flashback. What we want is for your body to know you're here in time and that's happened then.
Yep.
Right? So phases 1 and 2 is to prepare people to deal with that. Now, if people have significant traumas, you need to prep them a lot to allow to handle emotions. Or if as part of their growing up in their boot camp, they didn't have experiences with emotions, they have to learn how to have experiences with emotions before you dive into the reprocessing part.
Right.
Right? And those phases are good. Now you start talking about phases 3 and 4 a little bit. What are those phases? Like now that we kind of put that stuff out there.
Yeah. So as you mentioned, with those first couple of phases, so in the second phase with EMDR, you know, we identify kind of what is the strong negative core belief that you know maybe they're experiencing, that they feel needs to be addressed, and we start looking at the various different events that have occurred in their life that they feel associated to that negative belief. And we like to start with kind of the earliest of those. And the reason being, you know, I like the idea of it's like a weed, right? If you start at the top or something more recent, well, maybe that might help a little bit, but that weed's going to grow right back.
Right. Just like ripping only the leaves out of the
ground,
off of the plant, right?
Right. And so if we start at some of the earliest times we can remember feeling this way, we're getting rid of, or we're starting at the root of where this might have began.
Right.
And it makes it more likely that this isn't going to come back or grow back in a malicious way. And so we run into, so that's kind of the step 2. We go into step 3, which is kind of that pre-assessment, or where we're setting things up.
Right. Now you have that root memory, that specific moment in time, right?
Yep. And we get everything fired up. We get that person in that space that they need to be to successfully kind of reprocess.
Now, when you say fire up, you're meaning activated or starting to feel the emotions, noticing what's happening when we think about this, right?
And noticing the somatic portion of that as well.
Right, how it's affecting their bodies, yes.
Yeah. And then we move into the step 4 where we're reprocessing that feeling or the memory and the things associated to that. And during that process, there's a lot of interesting things that come up, right? People begin to perhaps notice certain thoughts or feelings or other things that are associated to that event. Sometimes other memories begin to come up that they find were connected to that. Or maybe there's parts about the memory that they had completely forgotten that they're now able to recall. And that step 4.
So step 4 is the part where we're having them notice through eye movement, right? Typically. I mean, they can do tapping.
Yeah, sound, buzzers, other... Yeah.
Right. But there's that dual stimulation. Now, why is that dual stimulation important?
The way I've understood it, the reason that it's important is because I mean, as you mentioned, we're stimulating that portion of the brain to help with the reprocessing, but also it's kind of in a sense a grounding effect, keeping them present in that moment so they
Right.
don't fall into the trauma that's occurred, right? And not only that, but it also helps with oh my gosh, my mind
Went blank.
went blank.
I
The
love
train's
that.
on the track.
Welcome to my brain.
Yeah. um,
But that's dual stimulation. So why we started with eye movements by Francine Shapiro, who's the founder of all this, did eye movements, was because we think it was related to dreams, right?
mm-hmm.
We don't know why we dream. We know that we dream in two stages. Stage 4, your deep sleep, and REM, right?
Right.
And so we think these are all hypotheses. We can't prove this yet because we don't even understand how the formation of memories is happening yet.
Right. And it's, well, and even like you mentioned, sleep. We don't know.
Right. We know that there's something about sleeping and dreaming is important to memory consolidation because when you interrupt those sleeps at different times, you disrupt both the short-term memory and also kind of the long-term memory creation formation.
Right.
You disrupt how they track the timeline, how the brain does that. We know that, right?
Right.
We just don't understand why. And so that's why it got this idea, the name from is the eye movement desensitization, because we're thinking, well, we're mimicking what happens during sleep, right? Eyes moving back and forth. And so we think that's why it's working as the reprocessing, that something happens when people sleep that it helps people move through traumatic events. But sometimes when traumatic events are so traumatic that the brain doesn't know how to reprocess it naturally, right?
And that's why, for example, one of those symptoms that we look for when diagnosing, PTSD is that fact of having recurrent distressing dreams, nightmares, those sorts of things, right? And we recognize that there's likely a reason if we're looking at that AIP, the EMDR type of a model, that there's a reason why that keeps coming up, where they keep having those distressing dreams again and again and again. It's almost again the train is stuck on that track, and the brain's like, I know I am supposed to reprocess in this way, but I'm not able to.
It's not going away.
Yep.
It's like Shrek, I'm looking down.
Yeah.
And it panics and it freaks out, right? And it just derails. And so we think that's why that was our biggest hypothesis, and today it's still our biggest hypothesis. Why of it is, you're right, there's two factors for it. Tapping or the vibration is and the dual stimulus is because it's happening one side then the other. So it's activating different parts of the brain in different areas, allowing us to be grounded, right? So there's a lot of unknowns why it works, but that's kind of the process of it. Of phase 4 is that let's go through this, and all we do in therapy really changes in that moment.
Oh yeah,
right. Instead of being like, okay, tell me about your week, and then it's a dialogue, right? It's like, what do you notice now? Go with that. Yeah. Then another set, right?
Right.
What do you notice now? Go with that.
Right. And I think in that phase, it is very client driven, in the pathways that are being created and made. Right. And I think that's definitely new and different for a lot of people, because in other therapies, a lot of times, people come in and it's like the therapist is going to feed me the breadcrumbs or tell me what it is I'm supposed to think.
Right.
And in EMDR, it's kind of the opposite way.
Right.
We're just sitting there and we're like, okay, you tell me what's going on now.
Yeah. And that's why that's somatic. Understanding, being familiar, safe in their body is so important. That is why phase 2 is essential in this model.
Yep.
If people do not understand and value how important it is that a client feels safe in their body, they're likely, kind of like going back to your analogy, to use the same tools of eye movement and make it worse.
Yep.
Right? I've heard of horror stories from peers and friends, other therapists who have said that they've had people do terrible EMDR work with clients, and clients refuse to do it with them anymore because of how traumatic that experience was. But if it's done safely, the results are remarkable.
Yes.
There's so much to cover here.
Mm-hmm.
So much that we could talk about. And I think maybe it's important that we kind of spend some time on that.
Yeah.
And so maybe we're going to have to do this, pick up with this one on the next episode too. But understanding, if people are interested in EMDR, I would strongly, strongly encourage them and invite them to go to EMDRIA, that's EMDRIA.org.
Mm-hmm.
That's EMDRIA, that's EMDR International Association. They're kind of the ruling body of all EMDR therapists, right?
Right.
They have great, tremendous research on there. Great videos to talk about it. But why I fell in love with EMDR is because of the phases 3, 4, 5, 6, 7, which we'll talk about next time. The release that can happen during that reprocessing is the most amazing thing I've ever experienced personally, but also professionally.
Yeah. And, I think what's important in understanding, again, the ideas of therapy and trauma, how we treat trauma through therapy, is that the reason I find EMDR so helpful is that for many people that I work with, cognitively, they've already, they have a good grasp or understanding regarding those things. They don't need any more help most of the time with that cognitive portion.
Right.
Because they've lived with that for many years. They understand, yes, this makes me uncomfortable. Yes, I don't like this, and I understand why. The thing that they struggle with is connecting with the emotional side of themselves in that trauma, and also being okay in allowing themselves to reconnect fully with that emotional side.
Oh, and you brought lots of ideas of what could work. The idea of how cognitions are just a good way to keep us safe, because it helps us avoid emotions, right? You brought up a lot of points of, this is why I work with a lot of professionals, and one professional is very brilliant cognitively.
Yes.
Emotionally, I would say immature, because he hasn't learned how to strengthen those muscles. And he has a son who's a therapist. He says, well, why don't you do CBT, DBT, ACT? And so my client came in and asked that, and I said, well, I can do that, but I can tell you're doing most of those principles now. I would lean into the emotional side. And the work we've done has been remarkable. He's like, okay, I get it. He now understands emotions. And this is a good place to leave off, I think, is that you are the expert in your life. Knowing what works best for you, I recommend finding a therapy and a therapist that meets those needs.
Yes.
Find what you need. If you have so many emotions, man, I'm sure as heck I'm going to pull out my cognitive behavioral therapy tools, right?
Yes. Yes.
Because we need to regulate it.
Right. If the emotions are running the show all the time, it's like, whoa, we need to bring some logic back into the conversation here, right?
Let's deal with logic. Because emotional thinking has its own problems.
Yes.
But if it's pure logic and there's why am I feeling this? I shouldn't feel this. This was 20 years, 50 years ago. I must be weak. Okay, we got some problems here. Let's deal with the emotion side and open that up.
And I feel like that is one of the biggest benefits I've seen with EMDR, is that it helps balance the scales between emotion and cognition.
It allows the heart and the mind to connect, is how I describe that. I might know I'm a valuable person, but I don't feel it here. My heart can't grasp and hold on to that.
Right. I know that I matter, and I tell myself I matter, but I don't feel that I do.
Right. So next time we'll continue this and talk more in depth about what it looks like in EMDR, our experience with that. Does that sound good?
Sounds good to me. So thank you again, everyone, for joining us on this episode, and we'll see you next time.